Hello, my friends and future funeral service professionals, and welcome back to another episode of Megan's study guide for the NBE. So for this episode, I kind of wanted to just dive right into sciences with a massive 190, I guess they call it terms or flashcards, pulled from this epic Quizlet, okay? Before I start with that though, I wanted to say, please go ahead and focus on your embalming textbook and your restorative art RA textbooks, because that is going to definitely lay the groundwork for everything you need to soak up for the sciences, okay? So if you are just starting to prepare, I would highly recommend, I know they're big, okay, I'm sorry, but I really can't recommend enough rereading neither of them are more important than the other. You really should just give both of them a good look over, because I can't say more details than that other than what I like to say with the textbooks and arts. You'll understand when you sit. You get me there, but I cannot emphasize the importance of your textbooks. So honestly, like, nothing can prepare you better than those textbooks. I mean, I could try. I intend to. Definitely worth it. But I like to give you a sound, like I said, like a good foundation, So anyway, with that being said, we're going to go on and move on to the Quizlet. Like I said, it's 190 terms or flashcards. It is titled NBE Science, created by gldmaster. As I always like to do, I will link you to the science Quizlet in my episode notes, and I will also credit the creator like I said, I try my best, okay? I want you to be able to go and look at it yourself, and I don't want the creator to hear this by happenstance and think that I stole it. So thank you, gldmaster, for your hard work. That is an epic Quizlet, and please don't laugh at me. This is a lot. I read over it. It's intimidating. Laugh with me, okay? You should be used to me by now. So, all right, let's do this. See, I'm already starting off like blah, blah, blah. I'm scared. I'm nervous. This is going to be embarrassing. All right. The mandibular sulcus is what kind of facial marking? Acquired. Now, anything RA, anything embalming is important in this set. They are really good with that, okay? All of these are good to know, okay? So, according to OSHA, the proper way to neutralize a formaldehyde spill is to add ammonia and wipe up. They love their OSHA. not gonna kid you. The line of lip closure is what distance from the base of the nose to the base of the chin? 1/3. Make sure you know your measurements and all of that, okay? The cardiac sphincter would be associated with the stomach. How many ounces of 32 index fluid are needed to make 2 gallons of a 2% fluid? 16. I'm going to go ahead and say that is very, very important. Anything with numbers and percentages, you need to make sure you know that ever so wonderful equation, and make sure you know that, okay? All right. The Galea ampanarotica is the tendon for which one of the following muscles? The occipitofrontalis. The right anterior superior iliac spine is the trocar guide for the cecum. CECUM. The amount of formaldehyde required to preserve all the body's protein is referred to as formaldehyde demand. That's very important. Please know this definition. I'm going to repeat this. The amount of formaldehyde required to preserve all the protein in a body is referred to as the formaldehyde demand. Okay. When using photographs, the frontal view best exhibits what? The length and the width. Know that. The hue sequence pink, rose, and cherry is indicative of red that has been what? Tinted. Which of the following bones are located within the bones of the face? Maxilla. So out of that, they're going to give you a list, obviously. You're looking for the maxilla. All right. Arterial tube connections can be identified as the following types. You're going to get a list, and you are looking for threaded, slip tight, and lure lock. Okay? Looking for threaded, slip tight, and lure lock. They might throw something random in there, but those are the ones you want to look for. Ultimately, know your arterial tube connections, but that should help you. All right. A substance that is capable of bringing about a reduction in the surface tension of a fluid is a surfactant. Which portion of the stomach is the most superior? Fundus. This is so fun. Haha. No, okay. Which of the following are considered malignant? You are looking for glioma and lymphoma. Okay? Glioma and lymphoma are the malignant ones. Formaldehyde in a dry powdered form is also known as paraformaldehyde. That's important. You need to know what paraformaldehyde is, okay? Intravascular blood discoloration is known as hypostasis. Which of the following muscles is found in the lowest extremity? The sartorius. Which of these will neutralize ptomaines? Methanol. And that's methanol with an A-L, okay? M-E-T-H-A-N-A-L, okay? The ovarian follicle is also known as the Graafian follicle. G-R-A-A-F-I-A-N. If I admittedly mispronounced that, I apologize. Anyway. The photo view, and before I jump into this one, okay, please, when you sit and take your science exam, please make sure that you read their questions fully, because just like arts, they are looking to trick you. They want to trip you up and confuse you. They want to make you feel like you know exactly what you're doing, get excited, but then you're going to get through the answers, and again, multiple choice, right? So you're sitting there and you're like, okay, I got the first two that are obvious, or maybe only one. And if you're looking at it even more confused, and say all four of them are possible or none of them make sense, you need to go and reread that question. It will greatly impact your outcome, because there will be a word like, what viewpoint, etc. You'll hear it in this question, and like this one's going to refer to a specific bone or what you're doing. It's just a good example of what I'm trying to say. Make sure you slow down just a little, take a deep breath, read the question, and process it. All right, so the photo view, which would best help to restore a fractured zygomatic bone, is anterior. Bacteria in the blood that is not growing or multiplying is known as bacteremia. You need to know your bacteria. That's important. The deceased was in, this is a great example of what I was just telling you, so I'm not going to repeat that. The deceased was in a motor vehicle accident. There are multiple fractures, including facial abrasions and deep lacerations on the face. Major restorative work is needed. Close the facial lacerations with which suture? This is super important. Basket weave. Know your suture types, okay? In and out. Basket weave, perched, all of it, okay? Very important. An organism that feeds on dead organic matter only, keyword, only, is known as a strict saprophyte. So that's very important. And know your different, all of that, okay? Know it. But also that first word being strict, only, there you go. The anatomical guide that lies lateral to the tendon of the flexor carpi ulnaris muscle describes the what? Ulnar artery. An inflammatory condition related to the nervous system is general paresis. That's important. All right. When attempting to locate the right axillary artery. The practitioner might facilitate the process by locating which of the following? You are looking for hairline of the axilla and the medial border of the coracobrachialis muscle. You need to know that, all right? That should sound kind of familiar. The medial border lies, know those. When attempting to locate the right axillary artery, the practitioner might facilitate the process by locating which of the following. Now, it says 1 and 2 only. That should be an option, but you don't know what 1 and 2 means. So you are looking for, because they might mix it up, right? So we are looking for hairline of the axilla and medial border of the coracobrachialis muscle, all right? So that's 1 and 2. When closing the mouth, the line of lip closure resembles a classic hunting bow because it has what? 3 gently dipping curves. What is the preferred treatment for eye enucleation? Now notice it says preferred. Ignore what you do or what your mentor does. Preferred based on what they're telling you. Remove the packing, cauterize, insert prosthesis, and then cauterize. All right, so remove packing, cauterize, insert prosthesis, cauterize that sucker again. To recreate pores in wax. Oh, this is so important. To recreate pores in wax, use a stipple brush. In comparing cavity fluid to arterial fluid, the cavity fluid will have what? No active dyes. Important. No active dyes comparing cavity fluid to arterial fluid, right? They differ from bacteria in that they are obligate parasites requiring living cells for growth, and differ from viruses in that they are retained by the, Berkfield filter. Sorry about that. They are rickettsia. Woo. All right, we got there. A malignant tumor derived principally from connective tissue is known as what? That is a sarcoma. You really, really want to know your different types of tumors. Sarcoma, glioma, all that, okay? So, moving on. Bleaching of blood discolorations may be done chemically by the use of all of the following acids except for sulfuric. All right. Physiognomy is the study of what? Face and features. That's important. Which of the following is true of Creutzfeldt-Jakob disease? It is always fatal. Yeah, yes. Inflammation of the testes due to trauma, metastasis, mumps, or infection elsewhere in the body is called what? Orchitis. Restored eyelashes should have no hair extended from the extreme ends of the line of closure. Those changes occurring in the interval prior to somatic death are known as antemortem. Make sure you know your mortems, okay? And, the somatic death, the deaths too. I'll call them that just because it's easier for this conversation. All right. What vein accompanies the common carotid artery? Internal jugular. And I know I said that other one pretty quickly, but we'll go over that in the future. Just make sure, I want you to know, regardless of where we are in this, when you listen to this, know your mortems, somatic death, all of that, all right? I apologize for the vagueness there. All right. A body being prepared has an open wound in the cheek, which is approximately 1.5 inches in diameter and has no visible tissue inside the hole. What kind of suture, revisiting another suture question, would be the best to use on this case? Now, you're going to be looking for specific parts of these suture questions. So once you know your sutures in and out, you should be pretty set with that jumping out at you. But as I said before, you really need to know your sutures because then you can apply them to their questions. If you don't know them, then that's going to sound Greek, all right? But anyway, so 1.5 inches in diameter, so round, and has no visible tissue in the hole, that would be a basket weave suture. All right. In regards to the formaldehyde exposure level readings, the action level, oh gosh, this is so very important. Know your action level. All right, in regards to the formaldehyde exposure level readings, the action level is 0.5 ppm. If you've already done like a comp ben course, that you'll know that that is very important to know, just for life. All right, C as in cat, HO, may react with water to form what? Methylene glycol. All right, hypoembalming a severed portion of the body would not include using paraformaldehyde. Sorry, got tongue-tied. Again, if you should know your different types of embalming, right? So hypoembalming, obviously you would not need paraformaldehyde because paraformaldehyde is what? A dry powder, right? So there you go. All right. Remember earlier I said you need to know what paraformaldehyde is? You could potentially get like several questions that are like that. And if you don't know what paraformaldehyde is to start with, you're going to go, huh? There you go. Good example. Returning answers for questions. Yay. Sorry. Anyway, minerals that cause hard water also promote what? Blood clotting. Minerals that cause hard water also promote what? Blood clotting. Okay. Which of the following is commonly caused by a coccus? Tuberculosis. A common ingredient in an autopsy chemical is paraformaldehyde. Telling you, like, very good to know paraformaldehyde. STEL. S, T as in Tom, E as in elephant, L for H, C as in cat, HO. I'm going to do that again. STEL for HCHO. Monitoring should be 15 minutes. You got to know your times. All right. Levels, times, very important. Also, know your purges. You need to know. I'm sure you do because they're pretty, what's the word I'm looking for? They correlate pretty well, so the description should fit, but know your purges. So that being said, creamy, white, odorless purge from the nostrils is probably going to be from the brain. Long-term uncontrolled diabetes mellitus frequently leads to atherosclerosis, an increase in the number of leukocytes above about 10,000 per cu/mm in the blood, and generally caused by the presence of infection and usually transient, is called leukocytosis. Bacteria that grows in the absence or presence of free oxygen are known as facultative. I don't know why, but I did not want to say that right. Okay. How many ounces of a 36 index fluid is needed to make 1 gallon of a 0.5% solution? 2. Solutions with the same osmotic pressure are what? Isotonic. The union of two arteries is called anastomoses. The 7th vertebrae in the neck region are called cervical. Which of the following is going to be the correct order of the layers of the stomach wall that the trocar must pass through when inserted into the stomach? Now it says 2, 1, 4, and 3, but you do not know if that's going to actually correlate, like, if that is a question or anyway. So we are looking at serosa, followed by muscularis, followed by submucosa, and then last but not least, mucosa. So to simplify that, we are looking for the layers of the stomach wall that the trocar must pass through when inserted into the stomach. Serosa, muscularis, submucosa, and then mucosa, all right? Assuming permission has been given, the first step after excising necrotic tissue is to chemically dry deep wounds. I know that assuming permission here is going to be a key thing because they might throw something in regarding permission. So, you're looking for chemically dry deep wounds if you see assuming permission has been given and necrotic tissue being excised, all right? Death of the whole organism. Remember I said you want to know your different phases of death? Okay. So death of the whole organism is called, that is somatic death. Complete and total death is somatic death. The term hematemesis, there we go, is used to describe that there is blood in the what? Vomit. Hematemesis, blood in the vomit. The component of arterial fluid that is designed to decrease the molecular cohesion at the surface of a liquid is known as, that is a surfactant. Which of the following is a value to the restorative artist associated with the 3/4 view of the photograph for restorative art purposes? It reveals the degree of fullness of the cheeks. Glands which carry both endocrine and exocrine, oh, this is important, functions are referred to as heterocrine. You need to know your different crins. That was actually painful to say, your crins. Whatever. You get my point. Which of the following are true of neoplasms? All right, so neoplasms, it says 2 and 3 only. So we are looking at number 2, grows by infiltration. And then other one is causes tissue damage. So what is true of neoplasms? Now you're going to probably see something regarding neoplasms, so make sure you understand this, you know it, okay? Grows by infiltration, and they cause tissue damage. Very important to know this. Okay. When jaundice is present in the body, you should use what? 1 and 2, which are, you want to use masking fluids and bleaching fluids. Very important to know your jaundice and what to do with it, okay? Jaundice is very important to know what to do, and you are likely going to see something regarding jaundice. All right. Tissues of the remains have varying levels of acids and bases. What modifying agent should be used in the embalming fluid? That would be a buffer. A body being prepared has an open wound in the cheek, which is approximately 1.5 inches in diameter and has no visible tissue in the hole. What consistency wax should be used during the initial application? Now you're looking for firm, and that's going to be wound filler, all right? The deceased was in a motor vehicle accident. There are multiple fractures, facial abrasions, and deep lacerations on the face. Major restorative work is needed. The preferred treatment for sunken eyes before embalming is hypotissue builder. You thought that was the same question as earlier, didn't you? I admit I did too, but it's not. Haha. All right. After embalming, the eyes appear distended. Acceptable treatment includes application of heat and surgical reduction. The study of the circulatory system is also known as angiology. A minute organism not visible with the ordinary light microscope is a virus. So excited with my answers. I don't know why. Incisions and excisions for restorative art purposes are usually made before arterial injection. Not after, before. Not during, before. Signs of life are feebly maintained during apparent death. Okay, another phase of death. All right. On your checklist, what is the most important thing when doing a hospital removal? That will be the deceased's name. All right. What is the science of structure and form without regard to function? That is morphology. An anti-polymerization agent for HCl C as in cat, OH is methanol, and that's methanol with an OL, not methanol with AL, right? I'm only saying it that way so that you can tell which it is, because which of the following is true concerning a child who has been diagnosed with rubella? And that's rubella. That's it. Rubella. Sorry. Rubeola. That's what happens when I read as I talk. All right. Active immunity will be established. The flattened section of the temporal bone is called the squama. The body has a mutilated mouth and chin due to a car accident. Which suture is best used to hold loose tissue flaps along the lateral areas of the wound prior to applying filler? Basket weave. Excessive production of urine is known as polyuria. You need to know that. A line drawn or visualized on the surface of the skin to represent the approximate location of some more deep-lying structure is the linear guide. Make sure you know your guides and just... What is the TWA for HCHO? 8 hours. Remember I said know your times? 8 hours. TWA, HCHO. The passage of embalming fluid through the capillary walls is the pressure filtration. A solution which resists change in pH is a buffer, turning to buffer. The artery which is located just behind the medial border of the coracobrachialis muscle is the axillary artery. Finger ligation on a cadaver will cause no change in color. In color theory, value refers to what? Lightness or darkness. Know your color theory, okay? Severe generalized edema is also known as anasarca. Red color in the skin comes from oxyhemoglobin and hemoglobin. Woo. Which of the following is not an imaginary horizontal line viewed on the face for the restorative art purposes? That is the lateral corner of each eye. So look, okay. All right. After extensive reduction by heat, you notice dehydration in the eye area. To restore it, you are going to apply cavity fluid. The place of incision for the radial artery is lateral to the tendon of the flexor carpi radialis muscle. Not a somatic mode of death. Ruber! Formaldehyde, glutaraldehyde, and phenol are hazardous because they are toxic to living tissue. That's kind of obvious. Okay. That'll help you out, though. They are hazardous because they are toxic. There you go. All right. A bacteriostatic agent will inhibit bacterial growth. Again, kind of obvious, ideally. If you know it, it will be. Otherwise, all right. The possible consequences of a thrombus include, it says 1 in 3, so we're looking at passive hyperemia and, I always say this wrong, ischemia. No, I'm pretty sure I did that okay. ISCHEMIA. All right. The number of oxygen molecules in 2Al, in parentheses, OH, and then number 3 is the number 6. If the nasal bones are damaged, the distorted nose may be restored by plugging with cotton through the anterior nares. The state or condition in which the body or part of it is invaded by a pathogenic agent that under favorable conditions multiplies and produces injurious effects is called infection. When embalming an individual who died from an acute myocardial infarction, which of the following problems might the embalmer encounter? Hydropericardium. Important. When restoring a sideburn, the application of hair should proceed inferior to superior. All right, so restoring sideburn, hair should be inferior to superior. All right, so top to, all right. Livor mortis is synonymous with cadaveric lividity. So before I do this next one, please be prepared and know your process for an infant, whether that be how to embalm them, know your infant information, all right? So with that, I won't say anything else, just that topic should be rather familiar to you, or you will be likely very frustrated. So the best choice for embalming a 1-day-old infant is abdominal artery, all right? Sodium citrate is used in embalming fluid as a what? Anticoagulant. The superior mesenteric artery supplies the small intestine. Which term refers to varicosity of the veins? And you're looking for hemorrhoids. For varicosity of veins, hemorrhoids. A pathological condition of the body that presents a group of clinical signs and symptoms and laboratory findings peculiar to it, and that sets the condition apart as an abnormal entity differing from other normal or pathological body states is a disease. Okay? Know that definition? List the following parts in order from the stomach to the small intestine that food passes through. You're looking for duodenum, jejunum, and the ileum. Do not laugh at me. That is how I know them, okay? If anything, it's very easy to know which ones I'm mentioning. Anyway, all right. If I don't laugh, I'll cry. If the patient died of ulcerative colitis, it is prudent to pack which orifice? Anal. All right. Which of the following has a direct connection to the cerebral arterial circle? It says 1 and 3 only. So that means you were looking for posterior cerebral and number 3, so internal carotid. All right. So posterior cerebral, internal carotid. Yay. Another name for pleural effusion is hydrothorax. Anasarca and hydrothorax are both similar in that both involve tissue fluids. Anasarca and hydrothorax are both similar in that both involve tissue fluids. A death was from natural causes, but the body was refrigerated for 24 hours prior to embalming. No autopsy is performed. In order to minimize abdominal distension and to prevent purge, it is important to inject slowly. Okay? I have found that when it asks something, and doesn't matter what, if inject slowly or low pressure, pay attention to those. All right. An infection of human papillomavirus, so HPV, can be manifested by the presence of genital warts. Nice little pathology question. Illumination with a dim light increases the feeling of sorrow. If the eyes swell during embalming, the swelling may be reduced by an electric spatula. So important. Eye enucleation repair should include, all right, and it gives you 2, 3, and 4, but that is going to be packing the orbit with non-absorbent cotton. Use superglue to hold the edge of the eyelid together, and then use an eye cap. All of the following are parts of the mandible, except for incisive fossa. Which of the following methods consists of injecting a few ounces of arterial chemical, then draining for a few minutes, each one separately? That's alternative. That is so important to know those ones. All right. Formaldehyde is what type of agent? Strong reducing. What superficial dermamycosis increases when associated with AIDS? Candidiasis. Candidiasis. I'm so sorry. I've only read that word. I need to get used to this. I'm so sorry. A general term for diseases characterized by excessive urination that's diabetes. When disinfecting removal equipment, you should use an aldehyde, an alcohol-based solution. When embalming a skin donor, the practitioner notices fluid leaking from the areas of the body where the skin was procured. Fluid leaks from these areas are because the dermis was exposed during the procurement of skin. Inflammation of the lining of the membrane of the heart is known as, that's pericarditis, okay? Body discharges from orifices, lesions, and biological vectors those are vehicles of exit. A sudden increase in the severity of a disease that is an exacerbation. The recommended 3% dilution of a 20 index standard arterial chemical that is used to embalm a body that has edema would be which of the following? 19 ounces of arterial to 109 ounces of water. All right, so body with that, lots of edema, you're looking for 19 ounces arterial to 109 ounces of water, and that's the 3% dilution of a 20 index standard arterial chemical. There's really no easier way for me to put that. I am so sorry. You just kind of have to remember the numbers. I'm so sorry. Edema, 3% dilution of 20 index, 19 ounces of arterial to 109 ounces of water. I don't know how else to shorten that for you. All right. A general term for describing any disease process that results in reduction in the mass of bone per unit of volume that's osteoporosis. When using quaternary ammonium salts to disinfect skin or instruments, it's important to avoid contact with soap. Not good. All right, diminished amount of urine formation is called oliguria. A new and abnormal formation of tissue or growth is a neoplasm. Remember I said you need to know your okay, cool. Which of the following is one of the basic linear forms of facial profiles? That you're looking for vertical, all right? A genus of microorganism that cause a wide variety of disease in man and animals, including ornithosis, which is what you're gonna look for, venereum and trachoma you are looking for chlamydia, okay? An immunity given by a vaccine is artificially acquired immunity. In what position are complementary hues found on the color wheel? They are opposite each other. Formaldehyde reacts with ammonia to form urotropin. The causative organism in primary atypical pneumonia is Mycoplasma. Woo. To restore a wax end mustache, use long hair rolled between the fingers and coated with soap or wax. The concavities below the medial and lateral inferior margins of the zygomatic bones are known as temporal cavities. Surface tension is significant in disinfection because low tension liquids spread over a greater area. More water can be removed from tissues with embalming fluids that are hypertonic solutions. When embalming a body, cosmetic restoration is made easier by the use of eosin, so E-O-S-I-N. To ensure adequate distribution of the embalming chemical, you should observe all of the following except for skin bruising. A practitioner analyzes remains where tissue has been harvested from the anterior portion of both thighs. The best treatment would be which of the following? Cauterization with phenol, cavity packs, or embalming gel packs. Signs of death exhibited between the eyes of the disease include All right, it says 1, 2, and 3. We are looking for clouding of the cornea and flattening of the eyeball, loss of luster of the conjunctiva, and pupil dilation and non-response to light. When transferring remains from the stretcher to the table, it says 1, 2, and 3, which are going to be cover deceased's nose and mouth, preserve the deceased's dignity, and last but not least, always wear personal protective gear. Don't skip that. Please remember your PPE, like your gloves, please. If you don't have it, like some funeral homes will like put that on your stretcher for you. If you just work and do transfers and removals, cool. But if you don't see them, I've seen it happen and it made me cringe. Please don't mess around. Some of the stuff that you come in contact with is really, really serious, and you don't always know what they have. Please remember your PPE. Wear your gloves. The deceased has been in a prone position that has allowed lividity to develop in the face. If the practitioner utilized a restricted cervical injection and is injecting the body separate from the head, embalming fluid may be distributed to the areas of the face because of collateral circulation through the vertebral arteries. Naturally active, naturally passive, artificially active, and artificially passive are all types of acquired immunity. After blood passes the mitral valve, it will be in the left ventricle. After birth, red blood cells are created by the red bone marrow. An infection that enters the body from the outside through one of the portals of entry is exogenous. The width of the nose at its base is equal to the width of the eye. Which of the following would be a pre-embalming restorative art technique? It says 2 and 4, which means we are looking at temporary closure of wounds and ligating torn arteries. Histoplasma occurs in high numbers in the Ohio and Mississippi River valleys, but has a low incidence nationally. This is an example of which of the following? That is an epidemic. When making a home removal, the 16-year-old son authorizes embalming. You should always obtain permission from an adult. Not of legal age. All right, 18. While moving the remains of a 95-year-old, the femur seems to be frozen in place. This suggests the presence of ankylosing. Which of the following stain removers would remove nicotine stains? We are looking at lemon juice, surprisingly, and sodium hypochlorite. An accident victim has severe facial lacerations and tissue separation. Before embalming, what treatment should be performed? You want to use temporary sutures. During embalming, the operator accidentally punctures himself, creating biohazard exposure. What obligation does the employer have? That would be to provide medical treatment and necessary testing to determine if the employee was infected. Given a 30 index fluid, how much fluid is needed to make 1 gallon of a 2% solution? 8.5 ounces. To replace naturally short hair, the best method is to attach with wax. Rocky Mountain spotted fever is caused by rickettsia. Going back to that one. Which of the following is associated with the brachial artery? That is the basilic vein. The study of tissues of the human body with the aid of a microscope is histology. A final and positive sign of death is generalized decomposition. Death by submersion in fluid is called drowning. For which of the following is it essential that hospitals and community services have a plan for the expeditious mobilization and use of their services? Disaster. Which of the following is not used in the preparation of an autopsy body? That would be wetting agent, and also very important to know. The zygomatic process is a feature of which of the following bones? Temporal. All right, an examination for early signs of death includes which of the following? We're looking at 1, 3, and 4, which is digital pressure for carotid pulse and light test for pupillary response. So if their pupils and their eyes respond to light. Checks for agonal dehydration and rigor mortis. And then last but not least, observations of the eyes for clouding and flattening of the cornea. Viruses are unaffected by antibiotics, which is why your doctor does not want to give them to you when you have a virus. All right. Which of the following is most likely developed from thrombophlebitis? Got it. Edema. Woo. Sorry, it's like some of these words. Woo. Autoclaving involves sterilization using moist heat. Love that word. Bacteria which cannot exist in the presence of free oxygen are obligate anaerobes. Decomposition of fats is called lipolysis. One of a class of complex nitrogenous compounds that occur naturally in plants and animals and yield amino acids when hydrolyzed are the proteins. A loss of function, either partial or complete, as resulting from a blow or fall is a concussion. Which of the following are methods of evaluating and monitoring fluid distribution? You are looking for staining dyes and tissue dryness. Facial trauma with multiple lacerations require the embalmer to first clean and disinfect the area and apply what? Temporary sutures. When blood flow to an area of tissue is decreased, oxygen supply is also decreased, causing a condition known as, that's that word I hate, ischemia. Bathing and chemically disinfecting the body is necessary because we have microbes in the blood are exposed to the surface during the embalming process. Disinfection is both chemical and physical. And then last but not least, lesions may continue to exude during the embalming process. It says 1, 2, and 3, but you know that doesn't apply necessarily. So those are 1, 2, and 3. Creutzfeldt-Jakob disease is assumed to be caused by a prion. And you don't want it. It's so bad. What organ should be given special attention in the embalming and preparation for babies? Remember I said babies are important here, okay? Make sure you know your infant stuff, okay? Super technical term stuff, but I mean it. So what organ should be given special attention in embalming and preparation for babies? That is the brain. Properties of formaldehyde. It is a colorless gas, soluble in water, and it combines with water to form methylene glycol. All right. Deep breath. After beginning science and the mouth Olympics that I am going to face with this section, oh boy. That being said, thank you for joining me for this episode. Thank you for your support. Thank you for your patience. And also thank you for laughing with me, not at me. Because good gravy. Ooh, this can be really embarrassing and drive your anxiety through the roof. I'm telling you that much. If you're considering doing a podcast, don't do one with big, painful words. But I'm here for you because I love you and I want you to pass and I want you to do well. So, all right. No, but seriously, good luck and tune in for the next episode. We will continue. I'm going to be waiting for my surprise that I mentioned in my other episode to start the glossary terms and other subjects, topics. Sorry, this took a lot out of me. I'm going to be doing more in-depth episodes, obviously. I just wanted to do something to start. I did not enjoy keeping you guys waiting, so I want to start doing this. With that being said, I'm going to look for other content as well. Like this Quizlet was we could do better, right? But it does cover a lot. Like again, we've got 4,000 questions, and this was 190, and there were a couple that actually like didn't hit, so I took them out. So, but we got close. But there are there's so many topics, and they're all really important. So bear with me. We're gonna do more in depth. I just wanted to start, right? So thank you again. Don't want to ramble. If you have your exam or exams coming up, good luck. Be calm. You've got this, all right? Even if we just started this, you've got this. I know you do. And if something happens or you just get the cruddy test questions out of the group, you have another chance. That's the best part. And you'll be more prepared then, right? Once you do it, it's like, oh, this is what I need to focus on. So, all right. Thank you. Take care. Have a good night or a good day, whatever it is. Just take care of yourself. Don't stress too much. We've got this. All right?